Good morning, everyone, and welcome to Central Valley today. It's a rainy, cool morning, but I think a lot of us have been hoping for a day like this, and we sure are going to enjoy the weekend. And I'm sure you're going to enjoy today's show, because coming up, we have chosen the winners of our Twilight contest. We have pictures that won the CVT viewers movie tickets and an e-book with more than 30 interviews from the cast members. Plus, it's not your ordinary vitamin shop. Find out why the owner of this store is promoting more than just pill popping. But we begin by giving hope to those suffering from depression. Learn about TMS therapy, which has been approved by the FDA. Central Valley Today begins right now. An estimated 19 million Americans suffer from major depression, and it's more than just feeling sad. Depression causes you to lose interest in things you enjoy, and it may have long-lasting effects. The good news is there is treatment, and here to tell us about that treatment, TMS therapy, is Dr. Bradley Wajda with Asano Incorporated. Good morning to you.
Good morning.
Dr. Wajda, how are you?
Real good, thanks.
Good. Why do you think it is that a lot of people don't actually admit to being depressed, or do they even know that this is a medical condition that can be treated?
Well, both of those are true.
Okay.
You know, a lot of people don't recognize depression because it has an insidious onset. It's a slow onset. Oh, okay. It's something that they just come to accept as unhappy circumstances. They start looking for solutions in other areas of life, be it occupation, relationship. And then, of course, there are people who don't want to admit to depression because they see it as some kind of a weakness instead of an illness.
So when do you think, or for the most part, from the patients that you've seen, is it the people themselves that are depressed that are coming to you first, or are they being referred to by somebody else?
Well, again, it's both.
It's both. Okay. Okay.
Usually by the time, and this isn't true of everybody, of course, but a majority of patients are coming because they've been identified as being depressed by family, okay, or they went to a family doctor and they said, look, I'm feeling depressed, and they tried some front-line therapies, and they find out they really need to go see a psychiatrist.
Okay. And as a psychiatrist, what do you recommend?
Well, when we did the segment on major depression, we talked about a variety of treatments, whether that's therapy or medication. It depends on the patient. It depends on their need. Of course, we rule out all the medical causes for depression. And one of the things I wanted to talk about today was a very unique drug-free approach to treating depression. And that's TMS, that transcranial magnetic stimulation. And I know that's been a subject that you've touched on before on this show. But, you know, it just is something that people need to be aware of as an alternative, because a lot of times medication creates systemic side effects. You take it, you swallow it, it goes over your entire body, and you start having to not only deal with the side effects. I mean, at that point, you're hoping you get a good response from the medication. You know, I will be watching the monitor just to see when we have certain things come up, because I know we did bring along some statistics that show some reasons why that's so important, because the longer you use an antidepressant approach, in other words, you try one and it fails, you try another, it fails.
And there are a lot of symptoms when it comes to antidepressants that, or side effects, I guess you could call them, you know, including weight gain, constipation, diarrhea, nausea, drowsiness, insomnia, anxiety, dizziness, and decreased libido even. I mean, the headaches, you obviously will get fatigue, and I think a lot of people would just think those are common, more so than the other ones, right?
Well, and those are the common side effects, and of course there are side effects that are truly significantly serious medical problems in and of themselves. So
Well, let's talk a little bit about TMS. And does TMS have any side effects? What exactly is it? How does it work?
Well, TMS actually uses magnetic therapy.
Okay.
In other words, it uses the magnetic coil that you see with an MRI machine.
Okay.
So it's harmless magnetic energy that's pinpointed to an area of the brain to treat depression. If you look on the screen, you can see that in terms of side effects that occur 5% of the time or more, literally with TMS there's nothing other than the potential for a little bit of discomfort at the point where you're applying the magnetic energy. When you look at the system-wide side effects from antidepressants listed there, I mean, that's significant, and again, that's only a portion.
Wow. And so when was TMS introduced?
They have been doing research with TMS since approximately 1986. But it was FDA approved in 2008 for treatment-resistant depression. And what makes that so significant is to be treatment-resistant means that you need to have tried a certain number of medications and failed. And to have adequately tried those medications means you will also been in treatment for several years. Now, when you look at the statistics, by the time you failed your third antidepressant, and this is according to the what's called the STAR-D study, you only have a 6.9% chance of success of treating your depression if you try a fourth antidepressant. If you look on the screen, you'll see by the time you fail the fourth antidepressant, almost 42% of patients simply quit trying. They just give up on therapy. And there's a lot of reasons why those antidepressants fail. The side effects, and also because of just an inability to treat and pinpoint the depression.
Now, you say that the treatment is comprised of about 30 treatments lasting for about 40 minutes apiece. Is the machine that you use, is that called NeuroStar?
That is the name of the machine by a company called Neuronetics. Now, there are other machines out there. You can see the machine on the screen now. There are other machines out there, but they are not FDA approved. This is a shot from our office. We're actually doing a video now because we have quite a passion for this with regard to pregnant patients.
Well, stick around because Dr. Wajda is going to continue talking about that topic in particular, pregnant women on TMS therapy. Is it safe? Yes, it is.
Yes, it is.
Yes, it is safe. A lot safer than antidepressant medication.
A lot.
Obviously, if you're pregnant. So we are sticking on the subject of depression, but we are focusing more on a common form known as postpartum depression. Can pregnant women take advantage of TMS as well? Obviously, they can. We'll just find out how when we return.